my name is Ramona Nedova. I'm a third-year student in the English program at MEV. I'm Bulgarian who was born and raised in Chicago, Illinois. I've always wanted to study medicine due to its intriguing complexity and how every single disease is similar but yet different based on the patients. I've spent my whole life translating Bulgarian to English and vice versa. One of my passions is teaching my colleagues about our Bulgarian traditions, culture, and history. Speaking of colleagues, I have a few to introduce to you today from Group 18, which have brought presentations on medical topics to spread awareness. Isabella is 20 years old from India and decided to choose medicine because she's always been fascinated with how the human body works. In the future, she hopes to become a clinician who can pursue research and contribute to medical education as well. Her favorite memories in Varna were walking on the beach after classes and watching the sunset at Sea Garden with her friends. Today's topic will be on osteoporosis and how often patients go undiagnosed, especially when they're elderly.
My topic is osteoporosis. So what is osteoporosis? Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases. This can lead to a decrease in bone strength that can increase the risk of fractures. Osteoporosis is the major cause of fractures in postmenopausal women and in older men. Fractures can occur in any bone but happen most often in bones of the hip, vertebra, and wrist. Who is at risk? Osteoporosis is the most common in non-Hispanic white women and Asian women. Among men, osteoporosis is more common in non-Hispanic whites. 1 in 4 people male at birth over 50 have osteoporosis. Certain medications such as cancer medications and glucocorticoid steroids may increase the risk of developing osteoporosis. Here we can see the chart of the incidence of non-Hispanic white women and Asian women having osteoporosis. The causes of osteoporosis are age. As we age, bone loss happens more quickly and the new bone growth is slower. Body size, slender, thin bone women and men are at greater risk to develop osteoporosis because they have less bone to lose compared to larger bone women and men. Family history. Researchers are finding that your risk for osteoporosis and fractures may increase if one of the parents has a history of osteoporosis or hip fracture. Changes to hormones. Low estrogen level in women after menopause. Low levels of testosterone in men. Men with conditions that cause low testosterone are at risk of osteoporosis. However, the gradual decrease of testosterone. Diet. Beginning in childhood and into old age, a diet low in calcium and vitamin D can increase the risk of osteoporosis and fractures. Excessive dieting or poor protein intake may increase the risk of bone loss and osteoporosis. Gender. The chances of developing osteoporosis are greater in women. Women have lower peak bone mass and smaller bones than men. The medications that increase osteoporosis are glucocorticoids and adrenocorticotropic hormone, which treat various conditions such as asthma and rheumatoid arthritis, anti-epileptic medicines, which treat seizures and other neurological disorders, cancer medications, which use hormones to treat breast and prostate cancer, proton pump inhibitors, which lower stomach acid, selective serotonin reuptake inhibitors, which treat depression and anxiety. Thyroid problems. Too much thyroid hormone can cause bone loss. This can occur if the thyroid is overactive or if you take too much thyroid hormone medicine to treat an underactive thyroid. Other glands. Osteoporosis have been associated with overactive parathyroid and adrenal glands. Medical conditions linked to osteoporosis are diabetes mellitus. The studies show that people that have type 1 diabetes may have low bone turnover and lower than normal bone formation. Since type 1 diabetes usually develop in childhood when the body is still building bone, someone with type 1 diabetes may never have the opportunity to reach their peak bone density. Second one is lupus and rheumatoid arthritis. People with both lupus and rheumatoid arthritis usually take corticosteroids for an extended period of time to manage their symptoms. Long-term use of steroids such as prednisone is also a leading cause of osteoporosis, possibly because they slow the activity of bone-building cells. Celiac disease it can damage the lining of digestive system and interfere with the digestion of nutrients, including the calcium and vitamin D that are so important to bone health. Asthma. People with asthma use corticosteroids such as asthma inhalers to help control their disease. Multiple sclerosis. People with multiple sclerosis take steroid-based medications to help manage their symptoms, and steroids are associated with bone loss. Since multiple sclerosis also affect balance and movement for many people, someone with MS may find it more difficult to get as much weight-bearing exercise as they need to in order to build and maintain bone. Hyperthyroidism. Hyperthyroidism increases the number of bone remodeling cycles you go through. COPD. There is a strong association between COPD and low bone mass or osteoporosis, usually from a combination of factors such as smoking history, low body weight, poor nutrition, and treatment with oral glucocorticoids. Diet and bone health. Bones are made of protein fibers filled with calcium and other minerals to create a hard structures. During childhood and early adulthood, they develop their strength, but from our mid-30s onwards, our bones start to lose calcium slowly. The key nutrients for bone health at all ages are calcium, protein, vitamin D. So, to maintain bone health, we should quit smoking, limit alcohol consumption, maintain a healthy weight, eat a well-balanced diet, and stay active. Calcium. Most adults need 700 milligrams of calcium per day. If you are taking an osteoporosis medication, increasing the daily calcium intake to around 1000 milligrams is needed. If you are breastfeeding, increase daily calcium intake to 1250 mg. Children and teenagers also need increased uptake of calcium. Vitamin D is essential for bones. There are 3 ways you can get vitamin D: from sunlight, from food, and from supplements. Low vitamin D levels could increase the risk of osteoporosis and broken bones, and a severe shortage of vitamin D causes rickets and osteomalacia, which is soft and weak bones. Oily fish such as herring and mackerel contain vitamin D. Eggs and some pork products, lamb's liver, fortified bread, and yogurt, and some processed mushrooms also have vitamin D. Healthy adults between 19 to 50 years of age, including pregnant or breastfeeding women, require 400 to 1000 IU daily. Those over 50 or those younger adults at high risk of osteoporosis obviously need higher intake of vitamin D daily. The role of protein in bone health. The low protein intake lowers both the production and action of insulin-like growth factors, which enhances bone formation. In addition, IGF-1 stimulates the intestinal absorption of bone mineral elements, calcium and phosphate, through an increase in the renal production of calcitrol, the hormonal form of vitamin D. In the elderly with osteoporosis, higher protein intake is needed. Protein intake is associated with higher BMD, a slower rate of bone mass, and a reduced risk of hip fracture. The economic burden of osteoporosis. The cost of osteoporosis carries a significant economic burden on countries in the world. The direct annual cost of treating osteoporotic fractures of people on average is reported to be 5,000 and 6,500 billion USD in Europe, Canada, and USA alone, not taking into account indirect costs such as disability and loss of productivity. Prevention of this disease can significantly reduce the cost incurred by the health system. Here you can see the chart. The social impact of osteoporosis are psychological and social consequences. From anxiety and depression to social withdrawal and isolation, if these problems are left unresolved, they can have a significant negative impact not only on health tissues but also on our overall quality of life. Physical and occupational therapists can teach exercises, home safety, and safe movement. Social workers can provide a framework for coping that enables individuals to improve their interpersonal interactions and minimize stress in their lives. The treatment. Medicines for osteoporosis, bisphosphonates, They slow the rate that bone is broken down in your body. This maintains bone density and reduces your risk of broken bone. Selective estrogen receptor modulators. They are medicines that have a similar effect on bone as the hormone estrogen. They help to maintain bone density and reduce the risk of fractures, particularly of spine. Parathyroid hormone. These treatments are used to stimulate cells that create new bone. You take them as an injection once a day. Hormone replacement therapy, the increased level of estrogen, which helps to protect from osteoporosis and other health conditions. Staying active can strengthen the bones. Exercise program for osteoporosis should include weight-bearing exercises, force your body to work against gravity, which helps to strengthen bones. Examples include walking, climbing stairs, playing tennis, and dancing. Muscle strengthening exercises use weights on your body's own resistance to work against gravity. Examples include lifting free weights, using a weight machine, working with resistance bands. Balance exercises improves your ability to hold yourself upright and help prevent falls. Examples, yoga. Flexibility exercises keep your muscles limber and joints mobile. They include yoga and stretching. Hip extensions, bridge, chair stand is also good. So here you can see the pictures.